Welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. If you are new to these question drill set sessions, what we're going to do is we are going to be covering musculoskeletal questions. We'll pull up a question, read it to you guys, give you about 30 seconds to answer, and then we will talk through why the correct answer is right. Be sure you guys use the chat. We have Nurse Samantha moderating for us today. So ask your questions. Be sure and follow us. We are almost to 50,000 followers, subscribers, all of the things on all of our channels. So help us reach that milestone before the end of the year. And share this session if you're able to. Invite a friend. Again, we're going to be covering musculoskeletal questions today. So a pretty wide range of topics. But with that being said, let's go ahead and jump in. All right, question 1. The nurse is caring for assigned clients. The nurse should first assess the client who: Option 1 has a femur fracture and altered mental status. Option 2 has a hip fracture and a discrepancy in leg length. Option 3 has osteomyelitis and reports pain rated as 9 on a scale of 0 to 10. Option 4 had a lower leg amputation and reports paresthesia in the amputated foot. All right, we've got 30 seconds on the clock. Go ahead and drop those answers in the chat. I'm going to get my chat open while you guys are answering. And again, be sure you guys are following us. Share this session. We have 8 questions we're going over today. And if you're just joining, we're covering musculoskeletal questions. All right, let's make sure it's working here. Looks good. All right, and I will give you guys about 10 more seconds to answer, and we'll go from there. All right, good answers, everybody. Okay, so if you've already answered, I'm seeing a bunch of right answers already. Tell me the condition you think is going on here, and you can get a bonus point. So very good work. All right, good job, you guys. So our correct answer on this one is option 1 has a femur fracture and altered mental status. So when we are talking about this question in general, we see the word first is bolded. So this is a priority question. So some of our basic prioritization strategies can be ABC, so airway, breathing, circulation, then safety and infection. Then other ones can be prioritizing based on the nursing process, anything like that. So what we're seeing in this question in option 1, a femur fracture and altered mental status, how those two things fit together is a fat embolism. So fat embolisms can occur when we have breaks in our long or large bones like our femur, and essentially little globules of fat can enter our bloodstream, and just like an embolism, like when we think of like a DVT embolizing, they're going to travel through our bloodstream and they can go into our brain, have the same effect that embolism of different material can have too. So including blood flow in our brain, that's, kind of what we're seeing here, altered mental status, one of those big manifestations. So this kind of falls in our C of ABCs, airway, breathing, circulation. This is a circulation issue. And we're also worried about our brain. Our brain is extremely important. If we're seeing changes in it due to a broken leg, we're going to kind of question what's going on here. So our priority is going to be option 1, but let's look at options 2, 3, and 4. So one of our other ways we can kind of approach this question is seeing like we have a kind of like a situation in each of these option choices and a finding. So we're looking for which one's really a complication. So a complication of a femur fracture is a fat embolism. So that's what we're seeing with altered mental status. But option 2, a hip fracture and discrepancy in leg length, we're going to expect that. That's what's going to happen when we break our hip. Or that bone is going to be dislodged and we're going to have one leg's going to be shorter than the other. Option 3, same idea, osteomyelitis and pain. If we're having infection in our bone, we're going to expect to have pain. That's not indicating a complication. We're going to expect that. And then option 4, lower leg amputation and paresthesia. That's what we would call phantom limb pain. Again, a non-emergent finding for that condition. So good job, you guys. Well done. Okay, question 2. The nurse is observing a staff member caring for a client who has compartment syndrome. Which of the following actions by the staff member would require the nurse to intervene? Select all that apply. Option 1, elevating the affected extremity above the level of the heart. Option 2, assessing for a distal pulse in the affected extremity. Option 3, preparing supplies for a fasciotomy of the affected extremity. Option 4, placing cold compresses on the affected extremity. And option 5, applying a compression bandage to the affected extremity. I feel like I said affected extremity 25 times. So we're thinking about the affected extremity on this question. Again, select all that apply. You'll have more than one right answer. 30 seconds on the clock. Drop those answers in the chat. And while you guys are answering, this is a little bit longer of a question. Tell us if you have passed your NCLEX. This is the best part of all of doing these lives, is seeing all of the new NCLEX passers out there. We would love to celebrate you. And if you guys haven't taken it and you're taking it soon, let us know. We want to wish you good luck. And as always, if you guys have passed and you have any knowledge you want to share with the next generation of nursing students, check out our website at uworldnursing.com. We have a little place on there where you can share a testimonial if UWorld was part of your NCLEX journey. Very good, very good. All right, let me see if we've got any passers. I'm seeing a bunch of great answers come in, a lot of 1, 4, and 5. You guys did great on that one. We've got some that are still in nursing school. Thank you for being here. Awesome, awesome. All right, good work, you guys. Okay, you did great on that one. I will, oh, we have Lindsay on TikTok. That is amazing. Good job. You passed your NCLEX, 4 years ago. Very good. Well, thank you for being here today. Awesome. All right. Cool. Our correct answers on this one are going to be options 1, 4, and 5. Okay, so again, select all that apply. We have more than one right answer. One of our strategies we can use for this is taking a true-false approach to each question. So when we are talking about compartment syndrome, it's a limb-threatening condition, and it's going to happen from increased pressure within an extremity compartment. So usually it's due to like swelling, like from a fracture or tissue trauma, or external pressure like a cast or a restrictive device. So the blood vessels and nerves become compressed. So if you kind of think of them as like a nice round straw and then they could become flattened, kind of like a sandwich, we're going to have impaired tissue perfusion and nerve function at the site of the injury. So we're going to see some signs of neurovascular compromise, like really severe pain, prolonged capillary refill due to tissue ischemia, so impaired blood flow to that tissue. So if we don't treat it, compartment syndrome can lead to the loss of limb, and like limb function, paralysis, and even tissue necrosis can happen. So when we're talking about what we should do for a client who's experiencing compartment syndrome, we want to make sure we're positioning the affected extremity at the level of the heart. So this question is asking us what we should do to intervene. So we're looking for actions that are not appropriate. So option 1 says elevating the affected extremity above the level of the heart. We want to position the extremity at the level of the heart. We want to encourage that blood flow and maintain as much tissue perfusion. Then option 4, placing cold compresses on the extremity. That's going to promote vasoconstriction, so we don't want to apply cold compresses. So we're going to want to intervene on option 4. And then option 5, applying a compression bandage to the affected extremity. We don't want to provide even more compression to those vessels and those nerves than what's already happening. So a lot of times, a fix for compression syndrome, compartment syndrome is fasciotomy, which is essentially opening up that compartment. So that's like the opposite of a compression bandage. It's kind of allowing that opening of everything. And then what we see in option 2, assessing for distal pulses. This is a way we're going to assess compartment syndrome and the severity of it. And then option 3, preparing supplies for fasciotomy. Again, this is one of the interventions that's appropriate for compartment syndrome. So good job, and good job catching, intervene, and knowing what to look for. I saw a bunch of people answer 1, 4, and 5. So well done, well done. All right, question 3. The nurse is caring for a client who is in balance, suspension, skeletal traction. Which of the following actions should the nurse take? Option 1, place the client in a side-lying position. Option 2, maintain the head of the bed at greater than 30 degrees. Option 3, remove the weights briefly every 2 to 4 hours. Option 4, allow the weights to hang freely off the edge of the bed. All right, 30 seconds on the clock. Drop those answers in the chat. Let's see what you guys think. Good work. I'm seeing a lot of option 4s come through. Great answers, everybody. And again, it's not too late to share this session. The more the merrier. We invite all of you guys to join our UWorld Nursing community. It's a great community to be a part of. We have lots of great live content on our channels as well as on demand. So when we're done, this will be available to you guys across our platforms. So we hope you guys can check it out. That's so good. Awesome, awesome. All right, great work, you guys. I will pull up our correct answer. So our correct answer on this one is going to be option 4, allow the weights to hang freely off the edge of the bed. So again, this question is asking us what we should do. So when we're thinking about balanced suspension or traction, what should we always do? And one of those big safety things that we need to know about traction is that those weights have to hang freely. That's the whole point of traction. So the traction and counter traction is what's keeping bones in alignment, keeping things in place. And so if we rest those weights on the head of the bed, that's not appropriate, that's not safe. The traction is essentially doing nothing. You're kind of losing the point of that intervention. So again, it's all connected through a pulley system and a rope, and that counter traction is going to, if you kind of think of you have a break in your bone and they're like this, that traction is going to pull it so that it's in alignment and that things can become stabilized and start to heal. So that's what we're looking for. Option 1, the sideline position, clients need to be flat on their back. Option 2, head of the bed greater than 30 degrees. Typically, you're going to be much less than 30 degrees, even typically just flat. And then option 3, remove the weights briefly every 2 to 4 hours. Again, it's continuous, so we want it to continuously be providing that therapeutic result for these clients. Good work, you guys. Okay, question 4. The nurse is teaching a client with osteoporosis who is receiving Alendronate. Which of the following information should the nurse include? Option 1, ensure you take the medication with food. Option 2, lie down for 30 minutes after taking Alendronate. Option 3, drink an 8-ounce glass of water with the medication. Option 4, take your other morning medications with Alendronate. All right, 30 seconds on the clock. Drop those answers in the chat. And let us know if you guys were on yesterday. We covered COPD with Nurse Samantha, one of our more challenging topics I think we learn in nursing school, especially understanding like the hypercapnic versus hypoxic respiratory drive and what's safe for these clients. So COPD is a tricky concept for you guys. Go check out that live. It's really great. A lot of practice questions at the end too. And we tied into what we did the previous week, which was ABGs as well. So kind of a little build up on that one. So cool. Good answers, you guys. And again, thanks for everyone who's following us. We're so close to reaching 50,000 followers. So help us do that on all of our channels before the end of the year. And again, thanks for sharing this session. All right, our correct answer on this one is going to be option 3, drink an 8-ounce glass of water with the medication. So talking in general about Alendronate, the medication, it's a biphosphonate medication. It's commonly used to treat osteoporosis and decrease the risk of osteoporosis-related bone fractures. So how the medication works, it inhibits osteoclasts, which are cells that cause bone breakdown. So if we inhibit the breakdown of bone, it allows bone building to occur more quickly. So biphosphonate should be taken on an empty stomach, ideally 30 minutes before or 2 hours after eating, to make sure that it's absorbed appropriately. So giving biphosphonates with a full glass of water and remaining upright for 30 to 60 minutes is going to help promote like the complete passage of the medication into the stomach and reduce any reflux of the medication into the esophagus. So that's our correct answer. Taking it with a full glass of water, it's going to allow the medication to be absorbed appropriately and not cause any complications. So good work on that one, you guys. Again, option 3, drink an 8-ounce glass of water. All right, good work, good work. And again, what we see, option 1, we don't want to take it with food. Option 2, 30 minutes after, we don't need to I need to remain upright, so not lay down. And then option 4, take your other medications. We don't want to take Alendronate with other medications to interfere with its absorption. All right, good work, you guys. Okay, a diet question. Question 5, the nurse is teaching a client with gout about low purine foods. Which of the following foods should the nurse include? Select all that apply. Option 1, aged cheese. Option 2, canned tuna. Option 3, smoked turkey. Option 4, yogurt. Option 5, avocado. Let us know in the chat. 30 seconds on the clock. And again, if you guys are new to our UWorld nursing community, one of the first places we hope you'll stop after this live is uworldnursing.com. We have our events calendar on there, so you can check out our schedule of all of our upcoming lives and what we'll be covering. We also have links to our subscriptions, including a 7-day free trial, and then also other great resources for all of our NCLEX passers, a way to collect your testimonial if UWorld was part of that journey. It's just a great kind of launching off point for the UWorld nursing community. So we hope you guys will check it out and sign up for updates about our upcoming events. Very cool, very cool. All right. I have someone asking about where you can see the COPD review. You can see that on Facebook or YouTube. We have that available on there. All right, and good answers coming in, everybody. Well done. All right, so our correct answers on this one are going to be options 4 and 5. So again, it was select all that apply. We're going to have more than one right answer, and we're just looking, this is a basic kind of understanding of diet for gout. So talking about gout in general, it's an inflammatory condition. It's caused by an ineffective metabolism of purines. So these are like an accumulation of uric acid in the blood. So as uric acid levels increase, crystals form in the synovial fluid, which is essentially that space between our bones, and it's going to result in warmth, redness, swelling of our joints, severe pain, fever, and then eventually over time we can have this formation of what we call tophi, which are visible nodules of uric acid crystals. So thinking about crystals in our joints sounds extremely painful, so that's kind of what we're thinking about when we're thinking about gout. So we need to encourage these clients to consume low purine foods. So again, gout is caused by high purines, which contributes to high uric acid in our blood. So we're looking for low-fat dairy products, like milk, cottage cheese, yogurt. We're looking for avocado, nuts, legumes, fresh fruits and vegetables. Purines are going to be high in foods like red meats and some seafood. So that's what we're seeing in options 1, 2, and 3. So again, options 4 and 5, those are low purine foods. Those would be appropriate for our condition. All right, question 6. The nurse is observing staff members caring for assigned clients. The nurse should intervene if a staff member is observed. So keyword is intervene, so think about that as we're reading. Option 1, encouraging a client who had an above-the-knee amputation 6 hours ago to lie in the prone position for 30 minutes. Option 2, assisting a client who had a below-the-knee amputation 12 hours ago to move from the chair to the bed after sitting for about 45 minutes. Option 3, placing a pillow under the residual limb of a client who had an above-the-knee amputation 2 hours ago. Option 4, teaching a client who had a below-the-knee amputation 24 hours ago how to perform active and passive range of motion exercises. All right, that's a lot of words to take in. Let us know what you think. Drop those answers in the chat. A lot of correct answers already coming through, so good job, you guys. Well done, well done. Good work. Awesome. And we have 2 more questions left. And when we're done, be sure you let us know how you do out of 8. And again, I offered 1 bonus point on question 1, so you can add that in. And just a note about tomorrow, we will be live at 3 p.m. Central Time with Nurse and Coley. So come back for another question drill set. And then the end of the year is like right around the corner. It's a little bit crazy, so check out our events calendar for more of what we've got to offer before the end of the year. Okay, our correct answer on this one is option 3. So again, we are looking for, and when we see intervene, we are looking for an incorrect action. So that's kind of the key. We're looking for what shouldn't be going on with the client that's had an amputation. So when we're talking about a lower extremity amputation, so it can be either above the knee or below the knee. That's kind of like the marker. One of the biggest elements of rehab is preventing contractures. So prolonged hip flexion, so think about if you're flexing your arm, think about that in your hip joint. Prolonged hip flexion causes tightening of the muscle, and that can restrict joint motion, and that can lead to a lot of pain and then unsuccessful prosthesis placement. So to prevent hip flexion after amputation, clients should avoid prolonged flexion of the residual limb and or hips. So thinking about things that can cause that flexion. Elevating that limb on a pillow, it's going to cause, if your limb is like this and you put a pillow under it, it's going to cause that flexion. So that's what we're worried about. We don't want to promote any movement or positions that can increase contractures from happening. So what we see in option 1, this is appropriate. Laying prone is going to stretch that hip. Option 2, moving, ambulating, all of this again is good. It's going to help prevent contracture. And then option 4, 24 hours active and passive range of motion exercises. Again, we're going to get everything moving as fast as we can. So all about preventing that muscle from shrinking, contracting, and causing complications. All right, good work, you guys. Okay, question 7. We're almost done. The nurse is teaching a client with osteoarthritis who is reporting pain and swelling of the right knee. Which of the following information should the nurse include? Select all that apply. Option 1, avoid splinting your right knee. Option 2, perform weight-bearing aerobic activities regularly. Option 3, apply heat and cold therapy to your right knee as needed. Option 4, place a pillow under your right knee while you are sleeping. Option 5, take prescribed over-the-counter NSAIDs to manage your pain. All right, 30 seconds on the clock. Drop those answers in the chat. And again, thanks to everybody who has shared this session and invited a buddy. We hope it was helpful. Again, we'll have this session available on demand when we're done on our channels. So you can go back and practice if you're just joining us, or if you missed any questions, we'll have it all available for you guys on our channel. All right, good work, you guys. Good answers. Again, select all that apply. We're talking about osteoarthritis. You can kind of just think about the mnemonic RICE, if that's helpful. I won't tell you what it is till we pull up the answers, but just kind of general management of arthritis or bone injuries, conditions, things like that. Okay. So our correct answers are 3 and 5. You guys did great on that one. I saw a lot of 3 and 5s. So I'm talking to this again, it was just kind of general plan of care for our client, making sure they're understanding what's appropriate. So osteoarthritis is a condition of our joints, our synovial joints. So think about knees, hips, fingers, and it's causes progressive erosion of cartilage and the bone beneath it. So as the erosion continues on, bone spurs can happen and calcifications can develop in the joint space, and that cushion between the joints is going to start to break down. So this can cause joint pain, deformity, and some instability. So RICE, which stands for rest, ice, cold or heat, and elevation, those are going to be some of our kind of basic interventions that we use for these clients. And then we're also going to give them NSAIDs to help reduce inflammation. So what we're seeing in this question, option 3 and 5, that's all appropriate. And then what we see, option 1, splinting, can actually be helpful for these clients. So stabilizing that joint, because again, we can have some weakness in our joint. Option 2, perform weight-bearing aerobic activities regularly. If we're having pain and swelling, like kind of like an acute exacerbation of osteoarthritis, we're going to want to rest that joint. We're not going to want to overdo it. And if we do anything, do something that's not going to put more strain or stress on that joint. And then placing a pillow under the right knee while you are sleeping. We would want to put that pillow under the feet to help reduce that swelling. We don't want to kind of create like a slope for blood to pool or anything like that. So we want it to all to go back to the heart. So good work on that one, you guys. You did great. All right, last question. The nurse is teaching clients at a community health fair about prevention of back pain. Which of the following information should the nurse include? Option 1, lift heavy boxes using your arms. Option 2, avoid body movements that twist your spine. Option 3, pull rather than push when you are moving objects. Option 4, lock your knees when standing for extended periods of time. All right, 30 seconds on the clock. Drop those answers in the chat. And again, we are so excited. Next week, we will be giving away some free subscriptions to UWorld Nursing. So come back to our lives next week on Tuesday, Wednesday, and Thursday. Tune in to learn more about how you can kind of get in the running for these. But again, we'll be giving away a free 30-day subscription during our lives next week. So So be sure and check them out. And again, before we're done today, be sure you guys drop any suggestions of topics you want to hear in the chat. We're always looking to add them into our content calendar. Again, we're doing this for you guys. We want to be helpful and the best resource we can be for you. So if there's topics you're struggling with that we haven't covered or you don't see on our event calendar, let us know and we will create some great content for you guys. All right, our correct answer on this one is option 2, avoid body movements that twist your spine. So when we're talking, this back pain is so important for you guys as nurses, being at the bedside, being on your feet, moving patients up and down in beds, helping them stand, all of that. Just the basic mechanics of how to protect your back and your spine is important for all of us to know, and especially for educating clients. So again, when we're looking at this one, our little tip on here is pretty helpful. It says, don't get confused by negatively phrased options like avoid. So this is a negatively phrased option. So avoid body movements that twist the spine. It's also a positive, a negatively phrased option, but it's a correct answer. So that is our correct option on this one. And then we don't want to twist our spine. That's not a way to protect our movement. We always want to be square. I don't know if anyone can see close enough, but we actually have it tagged on there with our little star. So that I hope everybody got that one right. And then lifting boxes with your arms. You want to lift with your legs and stabilize your core. Pull rather than push when you're moving objects. Pushing is going to be more protective to our back, and then lock your knees when standing for extended periods of time. Locking your knees is just how you pass out. We don't ever want to do that. That's not good advice for anybody. So again, you guys did great on that one. Well done, well done. And congrats to our viewer, Darcy, that got a 9 out of 8. I'm glad you got the bonus point. Well done. That's great. And good luck to all of our upcoming test takers. We hope eWorld can be part of your journey. Check us out at eWorldNursing.com. And be sure and come back tomorrow at 3 p.m. Central for another question drill set. Awesome job, you guys. See you next time.